Well, good morning and afternoon, everyone. I'd like to welcome you to the Canada Fetal Alcohol Spectrum Disorder Research Network's webinar called Canada's Guidance on Alcohol and Health, Knowledge Mobilization and Uptake 2 years later. Thank you so much for joining us today. My name is Lindsay Wolfson. I'm going to be your moderator today. And for those of you who don't know me, I'm the manager at the Center of Excellence for Women's Health and a frequent collaborator with the Canada FASD Research Network, the hosts of today's event. In my role, I'm responsible for a lot of research and collaboration on projects related to FASD and healthy beginnings and the integration of gender, trauma, equity, informed approaches in policy research and practice. I will introduce our three great speakers momentarily, but before I do, I just want to acknowledge the First Nations Inuit and Métis as the first inhabitants and traditional custodians of the land in which we live, learn, work, and play. Today, I am joining from the traditional territories of the Haudenosaunee, Anishinaabewaki, Mississaugas of the Credit, Mississauga, and Wendake Niamh-Wensentio peoples, but I recognize that we are all joining from diverse territories across Turtle Island. An important step in reconciliation is the acknowledgement of traditional treaty lands and recognition for the people of the territory. The Canada FASD Research Network recognizes the historical significance and contributions of Indigenous peoples and their cultures and understands the important role that Indigenous communities play today and in the future. We acknowledge that we live, work, and meet on traditional territories across Canada, and many of the First Nations, Métis, and Inuit whose footsteps have marked these lands for centuries. So some housekeeping items for today. Today is our second webinar in a three-part policy series. If you missed the first one, Alcohol Policy in Canada, an introduction to the Canadian Alcohol Policy Evaluation Implications for FASD, you can find it now on the CanFASD YouTube channel. In today's webinar, we're going to be talking about Canada's guidance on alcohol and health, which was introduced in 2023. Our speakers will offer evidence-based advice on alcohol and how to support people in making informed decisions, describe the guidance, and how alcohol guidelines can bring attention to alcohol use during pregnancy, and knowledge mobilization efforts now that we're 2 years after the fact. We'll also be talking about regional initiatives that clinicians and the public can use to guide decision-making through their lives and in the perinatal period. Our final webinar in this series will be on March 12th, where we'll have policymakers from Manitoba and Newfoundland talk about collaborative alcohol policy efforts in their respective provinces, and will give us an opportunity to reflect on how we may adopt similar strategies or initiatives in our regions. So now to our amazing speakers. Our first presenter today is Dr. Adam Shirk. Dr. Shirk is a senior scientist at the Canadian Centre on Substance Use and Addiction and a scientist at the University of Victoria's Canadian Institute for Substance Use Research. His research focuses on alcohol and substance use epidemiology, health economics, and national drinking guidelines. He's an author of Canada's Guidance on Alcohol and Health and the Canadian Substance Use Costs and Harms Project, and Dr. Shirk lives in Saanich, BC. Our second presenter is Dr. Nancy Poole. Dr. Poole is the prevention lead for the Canada FASD Research Network, and she too sat on the scientific committee that prepared Canada's Guidance on Alcohol and Health. She's also the director at the Center of Excellence for Women's Health, which is a research and knowledge exchange center hosted by BC Women's Hospital and Health Centre. In that role, she leads network development, research, and knowledge exchange related to improving policy and service provision on a range of women's health and social justice concerns, including substance use issues. In 2021, Dr. Poole was awarded with an honorary doctorate of laws by the Justice Institute of BC in recognition of her contributions to women's health, including trauma-informed practice and the treatment of substance use and addiction. Our final speaker for today is Dr. Nirupa Goyal. Dr. Goyal is the Program Manager of Strategic Initiatives at the BC Centre on Substance Use. She oversaw the development of the National Clinical Guidance for the Treatment of Alcohol Use Disorder and the www.helpwithdrinking.ca website. She manages the 24/7 addiction medicine support line and many other clinical and public-facing initiatives. Prior to working at the BCCSU, Dr. Goyle completed graduate and postdoctoral research programs in neuroscience, studying the hormonal and behavioral responses to stress, and worked as a science policy analyst at the National Institutes of Health. So, welcome to all three of our phenomenal speakers today. I'm going to pass us over to Dr. Shirk to start our webinar today.
Hi, everybody, and thanks, Lindsay, for the wonderful introduction. Thanks, everybody, for coming today, and I'll speak about Canada's guidance on alcohol and health. As was said, I'm Adam Shirk. Next slide, please. If I could add on land acknowledgement, I would like to respectfully acknowledge that the offices of the Canadian Centre on Substance Use and Addiction are located on the traditional and unceded territory of the Algonquin and Anishinaabe peoples. As a national organization, we'd also like to acknowledge that we work on the traditional lands of many distinct nations, and including Métis and Inuit. A very quick agenda. We'll look at some motivation for the new guidelines. So why did CCSA go about creating new guidelines that came out in 2023 in the first place? We'll talk about what those guidelines are and the renaming to Canada's guidance on alcohol and health. And then we'll do a little bit of discussion around knowledge mobilization, knowledge exchange that I've called here a national conversation. Just quickly about CCSA. So you might not know, and I probably didn't know before I started working at CCSA, that CCSA was created by an act of parliament back in 1988. And CCSA was created as a non-governmental organization with the goal of providing national leadership on alcohol and substance use issues, and hopefully to advance solutions to address substance use health issues. So firstly, here a little bit of motivation around why we would want to think about creating or drafting new guidelines or guidance. Well, some background. So alcohol use and related consequences in Canada, I've labeled this slide as consequences, but it could also be labeled opportunities, because the idea here is that we know that alcohol has some health impact. Well, some of us know that. Not all of us know all of the different health issues that can be caused by alcohol. And so this is an opportunity. Alcohol is not for everyone, but for some of us, a modifiable risk behavior, a risk factor. And some of these stats here, more than 24 million of us in Canada reported drinking in the past year. About 1/3 of those, or 8 million people, reported heavy drinking. Every year, more than 18,000 deaths are caused by alcohol use, and some other stats there. So thinking about these as opportunities, there's not a ton of things that we can do to increase our health as a population in a drastic way. But changing our relationship a little bit with alcohol is potentially one of those things. Of course, that won't be possible for everyone. People that are dependent on alcohol or have come to become dependent on alcohol or may in future. But as a population, it's something that we could consider, just having a little bit more of a healthy relationship with alcohol, and that could lead to opportunities, taking away some of these consequences. Could go yet. Next slide. So this is from our study that we do at CCSA along with the UVIC's Canadian Institute for Substance Use Research, and it's called the Canadian Substance Use Costs and Harms Project. In that study, across 8 different substance types, we estimate the cost of substance use in Canada, with the most recent year being currently 2020. We're working hard to update that as we speak. So the overall cost of substance use in 2020 was just less than $50 billion. It was 49.1 billion, and it's hard to conceptualize, but to put it into perspective, it's about the same as the GDP of a province like New Brunswick. So it's pretty significant. Focusing in on alcohol, alcohol was responsible for about 40% of the total cost. And we can see from the bar chart that alcohol kind of sorts to the top in terms of delineating the most harmful, the most costly substance in Canada in terms of the impact on social spending. Thank you. Yeah, so time to update. So the previous low-risk drinking guidelines for Canada came out, they're in the pink there, they came out in 2011. And so in the decade after that, 2011, and kind of moving through the 2010s, there are some significant developments in the evidence-based knowledge about alcohol-related death and disease, evolving research on alcohol and social harms. And another thing that kind of gave some impetus was that other countries had recently updated their guidelines with limits that were significantly different from the 2011 Canadian guidelines and from those other countries, their previous guidelines. And so the evidence was kind of evolving, and it was decided that Canada should kind of follow through the process to update their national drinking guidelines. Along the bottom there, there's this kind of foundational idea, thanks, Lindsay, that people in Canada have the right to know more about alcohol and health. So there are still many aspects of alcohol and health that aren't kind of well known by the public. They're not common knowledge, and this is important from a public health standpoint and kind of uh, providing the tools to people so they can make the decisions that are best for themselves insofar as that is possible. We go to the next slide. I'll just take a few minutes here to introduce what the guidance actually was. If we go to the next slide. So in January 2023, just more than 2 years ago, amazingly, I think Nancy will probably agree it's hard to believe it's been 2 years, but 2 years ago, Canada's guidance on alcohol and health was released. It came with a package, like a final report in the bottom left, a methodological document in the top left, and then some public infographics and hopefully reasonably well easy to understand posters and things like that. If we go to the next slide. So the key recommendation coming out of the guidance, which you may or may not know given the coverage of it, was that to reduce the risk of harm from alcohol, it's recommended that people living in Canada consider reducing their alcohol use. And kind of implicit in this maybe is to learn more about alcohol and health and then think about whether or not they want to, as well as they're able, reduce their alcohol use in the light of that increased knowledge about alcohol and health. Next slide, please. And then we're going to have some slides just after this that are talking about drinks or standard drinks. So I just want to define what that means. So a standard drink, which is kind of like a unit of alcohol, right? A unit of alcohol or a standard drink means these different things because the stronger the alcohol, the higher the ABV, the less volume you need to make up the same pure alcohol. And honestly, it's a communications issue for us in public health. It's kind of difficult to get this across. I hope that you don't think that, that you kind of understand that a standard drink is this certain amount of alcohol, which is the volume is different between beer and wine and spirits or hard liquor, but not everybody does kind of understand that. And so it's a communications problem for us that we always kind of have to define and help move forward. It would help, of course, to have this labeled on alcohol containers where it gave you the number of standard drinks so that we didn't have to kind of guess or pull out our phones to do a quick calculation. So looking at that public poster, public summary, which is in the bottom left, then I've blown up this kind of continuum of risk or spectrum of risk that's related to Canada's guidance on alcohol and health. And so what we have here is, well, let me just say that previous guidelines and every other country's guidelines, they kind of just have a single number that you're either above or below. So it's basically a binary demarcation. Say they say something like 10 drinks a week or 20 drinks a week, and then you're above or below it. So something that we did a little bit differently in Canada, which I was really happy with, but of course you'll decide for yourself if you're happy with it, is that we presented this continuum of risk. And so it kind of shows people how the risk evolves as they drink a little bit more per week. So all of these numbers along the right are drinks per week. And so we have a no risk zone, which is not drinking, just like anything that carries some risk. The only way to totally have no risk if you want to do so is to avoid it. In terms of the low risk bucket, that's 1 to 2 drinks per week, moderate risk, 3 to 6 drinks per week. And then once you get to a drink per day, 7 drinks per week or more, the risk starts to go up a little bit more exponentially. And so the whole flavor here is that the more we drink, the higher the risk, which is very kind of, in terms of behaviors that carry risk, we're used to this being true. Lots of things carry risk, and the more that we do them, the higher the risk. So the idea here is to give people a better understanding of how the risk evolves in terms of how much we drink. If we go to the next slide. Yeah, also on the public summary is this icon, which I've blown up, which is related to pregnancy and breastfeeding. So when someone is pregnant, trying to get pregnant, or breastfeeding, there's no known safe amount of alcohol use. And when breastfeeding, not drinking alcohol is the safest. Next slide, please. In terms of, so those limits that I showed before, in terms of the continuum of risk or that spectrum of risk, that's really about long-term use or chronic use over time. But then there's also recommendations about per occasion drinking. How many drinks should we have at one time, which is maybe uh, equally a way that people think about kind of how much to use, how much alcohol to consume. So for per occasion drinking, the recommendation is that consuming more than 2 drinks in one occasion, on any occasion, is associated with an increased risk of harms to yourself, to others. It wouldn't always be the case, but certainly on average, that's true, including injuries, including violence, including things like motor vehicle collisions, and the list goes on. So for the per occasion drinking, it's recommended to limit to 2 or less when possible. And now if I could talk a little bit about our knowledge translation and exchange, which I've termed here as a national conversation. If we go to the next slide. So when the guidance was released 2 years ago, well, we'll see if Nancy agrees, but I think we didn't as part of the authorship committee, uh, we didn't exactly predict everything that the media would key on. And so the media I found anyway, when the guidance first came out, they really focused in on this 2 drinks per week limit, which was hopefully from the presentation clear that that wasn't really a focal point of the guidance. Now it does demark the difference between low risk and moderate risk. So, I mean, there's value in knowing what that is, but the media was kind of like quite focused on this 2 drinks per week number, which seems a little bit drastic in my opinion. So anyway, what it did was it created a lot of conversation, certainly. So, I mean, this slide's probably already a year old, but something like 500 million views, lots of different coverage in those publications like Time, The Guardian, The Globe and Mail, Toronto Star, New York Times. So it did create a lot of conversation, which was good. And then, of course, we had to describe the kind of main thrusts of the guidance being a little bit different than everybody in Canada limiting themselves to 2 drinks a week or less, which was never the intent. To the next slide. Oh, right. Yeah. So there's going to be things that appear here, but maybe I'll just like talk about them as they come, Lindsay, if we can do them kind of slowly. So this is the what I've called coast to coast amplification. So CCSA came out with a guidance, and there were experts across the country like Dr. Poole that were part of the authorship committee. And then when the guidance came out, a lot of different public health and health organizations across Canada took the guidance and they amplified it through different campaigns and messages. And so what I have here are some exemplars of our favorites, or I'll say my favorites so as not to implicate anyone else. The BC Ministry of Health and BC Cancer Agency did a really wonderful campaign about alcohol and cancer that was built on evidence uh, that was in the guidance called The Proof, and we can see that here. I live in BC, so I saw these. They were like also physical ads on buses and at the ferry and things like that, as well as having a strong online presence and social media presence. If you click next, here's one from CCSA's own Drink Less, Live More campaign, but some public health um, units in Ontario took them and put them on physical billboards that were out in different communities. If you hit next, Rethink Your Drinking was a campaign done by a public health organization in Ontario. If you hit next, Less is Best or Less is Better for Health is from Prince Edward Island, and that was from Live Well PEI in the bottom right there of the pink poster, and that built on top of the guidance. We hit next. Another one from The Proof, the BC Cancer Campaign, and I think there's one more, Less is Better for Health from New Brunswick. Reduce your risk of cancer, heart disease, and stroke by as able making informed decisions about your intake. If we could go to the next slide. This is CCSA's own Drink Less, Live More campaign. So after the guidance came out, maybe about 9 months or a year after the guidance came out, CCSA also produced this Drink Less, Live More campaign, which was focused on some of the positive opportunities that could come with drinking less, saving money, like in the bottom left, focusing more on exercise and things like that. That is reflected by some of the posters. If we go to the next slide, here I've titled International Inspiration. So when CIGA, that's the kind of awkward acronym for Canada's Guidance on Alcohol and Health. CIGA is what we call it internally, which is not my favorite acronym, but I guess that's how it is. So it has begun to have some influence on the world stage in terms of alcohol guidelines around the world, and some of our CCSA experts have been requested to participate when other countries are considering updating their guidance because their own national guidance is getting a bit older. SIGA, the guidance on alcohol and health, was featured by the World Health Organization, and that's what's on the right panel there, the pictures with the World Health Organization logo there in the top left. The United States is doing a guidelines review, and some of the members of the guidance expert panel were participating there. Ireland is considering, or they are updating their guidelines, but they're in the kind of pre-technical stages of that. and some of our experts were invited to participate on the technical expert panel. And also there are some things happening in Germany and also in New Zealand. I think if we go to the next slide, there's kind of just a summary slide here that distills this presentation into a single slide and kind of finishing with, so what do we need to know? You know, if we live in Canada or anywhere, but of course this is Canada's guidance, what do we need to know? So CIGA recommends that people in Canada, as able, consider reducing their alcohol use. And then I'll just say again, implicit in that is kind of learn more about alcohol and health. Like, why would we potentially want to reduce? We might want to do that because we didn't understand all the different health effects that alcohol could cause. Any reduction in alcohol use will come with health benefits, just like anything that carries risk. The less we do of that activity, the less risk that we'll be exposed to. These are, you know, none of these are definitives or definites, but they are kind of probabilities that stack up across our life course. And then finally, drink less, live more. And I think that was my final slide. Might just say thank you on the next one. But yeah, thanks for having me, and pass it over to either Lindsay or Dr. Poole.
Thank you so much, Dr. Shirk. It was so nice for you to articulate some of the nuances that came out of Canada's guidance and how to communicate it. I will pass it over to Dr. Poole, who will talk a little bit more about the implications and how we're considering Canada's guidance on alcohol and health, specifically as it relates to pregnancy and the sex and gender messaging. So, Nancy, over to you.
Thanks. Yeah, there we are, the CGA thing. The implications for FASD prevention. So yeah, the messaging about the sex and gender risks about alcohol use in pregnancy are included in the guidance. If you turn to the next slide, Lindsay. And, you know, as Adam showed, right, on one version of the infographic, you can see the messaging around pregnancy, trying to get pregnant or breastfeeding, and also the messaging around the sex and gender risks. But I would say that this information has not yet well enough been covered in the knowledge mobilization efforts that you saw that Adam shared. So I'm here to start that conversation, and I know Nirupa will also pick up on that. So, you know, for me, it's really important. We at the Center of Excellence work to identify all the factors and influences related to sex, gender, and alcohol for the scientific committee to consider. And I just feel as we make alcohol policy, that women, people of all genders, community leaders, and the public need to know that when females consume similar amounts of alcohol to men, it can lead to more negative health effects. And, you know, it's kind of summarized here with a quote from the guidance directly, but also the rationale. It's because female bodies break down and absorb alcohol faster than male bodies due to smaller average body size, smaller organs, less body water, different hormonal effects, and lower amounts of certain gastric enzymes that break down alcohol. So, for example, females experience more liver damage on smaller amounts of alcohol compared to males, and even low to moderate alcohol consumption significantly increases the risk of several cancers in females, including breast cancer. So lots to think about in terms of getting this kind of message out. Like Adam mentioned, you know, we're not trying to proscribe what people do, but people have the right for the information that we now know lots more about. So next slide. We all need alcohol policy that directly addresses the social influences on women's alcohol use and prevents stigma related to women who drink. And so we need to engage representatives of local women's organizations like Violence Against Women shelters and pregnancy outreach programs who can be helpful as we design messaging and local initiatives so that these influences are really understood and can be addressed. And that link on the right is to a social support intervention that we at the Center of Excellence are doing just now that has violence against women and substance use treatment services helping us design an intervention that's both about alcohol and about violence against women together. So what we're here for today is to talk about this slide in particular, that women and communities need to know about the harms of alcohol when pregnant and when planning a pregnancy and when breastfeeding, both for their health, because you can see on the one side there, the maternal health risks of alcohol use in pregnancy, and then for fetal health and the risk for fetal alcohol spectrum disorder. So we need alcohol policy that supports reduction or stopping of alcohol use in pregnancy as really important in supporting women's health and preventing FASD. And I guess I feel that the guidance can really be used as a way of opening discussion about these risks overall for women, but also when we're pregnant. And that approach can make the awareness raising and the decision making really safe and engaging and trauma informed. So yeah, the service providers, I think, can really be supported to discuss alcohol in the course of their work as physicians and midwives and public health nurses and Indigenous wellness workers, sexual health, anti-violence, pregnancy outreach, and substance use workers. We need everyone comfortable and competent to discuss alcohol in really engaging and non-judgmental ways, and to share ideas about low-risk drinking and gender-informed support services. And we need everyone to be respectful of women to their ability to change in this process. And I just feel that the guidance can be a foundation for these discussions. And then we can also take more information about how to share from documents like this one on the right, the Doorways to Conversation, that you can find on the Center of Excellence for Women's Health website. So lots to think about as we do this. But to me, the biggest challenge we have is that to these discussions of alcohol use with pregnant women is both on the side of women and on the side of the service providers. So some of the challenges for both sides are listed here, that women are afraid of losing custody, that they're afraid of being treated judgmentally for their use. That they fear being told that they have to go to some bed-based treatment if they say they have a problem, rather than learning about all the accessible community-based supports that are there. And on the other side, on the healthcare provider side, they're not necessarily fully prepared to discuss alcohol use. And they need access to the guidance and to be able to communicate it really well. And they're afraid if they start those discussions, women will be defensive and they'll lose their ability to connect. And they're not necessarily aware of how best to do it. But the research has shown consistently that that relationship is central in supporting it. And as Dr. Miller and Dr. Moyers emphasize in their book, one of their recent ones on effective approaches to counseling, it matters both what you have to convey, but also how you do it. So I just want to talk a little bit in the next slide about what we've learned over the years as the group of folks who are part of this virtual network on FASD prevention. And we've developed this consensus document on 10 fundamental components of FASD prevention from a women's health determinants perspective. And it includes all these approaches pictured here. And to me, it's critical that providers who are sharing Canada's guidance on alcohol and health consider these consensus points as a filter through which they share the guidance. It's also important that we link the guidance to all these other avenues for communicating the risks of pregnancy. So we've got the guidance sheet, like Adam and I have shown you, the infographic. We need warning labels on the alcohol beverages like the Australians have, which we don't yet have in all places in Canada. We need these great info sheets, and I know Nirupa is going to talk lots more about communicating using information sheets and other methods like that. And we could even be stretching ourselves as we link the guidance to community-based efforts like the Yukon folks have done with pregnancy test dispensers. In women's restrooms as a way of reminding women that it matters that you know if you're pregnant, so that you're not drinking before that pregnancy recognition moment, which happens sometime into the pregnancy so it's a key time for reducing the risks. And finally, I just wanted to mention that I think it's super important that we get behind the work of Indigenous communities as they are thinking and conveying this information from community-led and culturally-led supports in communities. And this is a picture of a document we have on the Center of Excellence's website as well, that representatives of the Cromody Friendship Center, the Gitchin Health Society, the Stolo Service Agency, and other communities described how they're doing FASD prevention from an Indigenous lens that's culture-led, and really amazing work. And they've spent time working with us in the Prevention Network Action Team, thinking about how we integrate the messages from the guidance and link it up to their work. So in summary, there's much we can do to prevent FASD and raise awareness of the harms of alcohol as they affect women, their partners, and support networks, using Canada's guidance on alcohol and health as a tool that can respectfully invite discussion and decision-making. So thanks for listening.
Well, thank you so much, Dr. Poole. It's so great to hear opportunities for how we can think through perhaps collaborative alcohol strategy as we relate it back to Canada's guidance on alcohol and health. I'm going to pass it to our final speaker, Dr. Nirupa Goyal, to talk about how BCCSU has taken up some of these opportunities that were presented with the release of Canada's guidance on alcohol and health. So Nirupa, over to you.
Thank you so much, and thank you for having me here today. And thanks to Dr. Poole and to Dr. Shirk for really providing so much context and inspiration for why this issue is important, and for describing how much work has already gone into amplifying these messages across Canada. And thank you, Lindsay, for inviting me and for introducing me. So I'm from the BC Centre on Substance Use, and I'll just first acknowledge where I'm situated. So we are located in what's colonially called Vancouver, So I want to acknowledge that that is the lands and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations. At the same time that the Canada's guidance on alcohol health was being developed, BCCSU was also embarking on developing a national guideline that is very similar to what Dr. Shirk was speaking about, but for a different audience. So we were focusing on the clinical guidelines for treating alcohol use disorder, but it very much dovetails with informing the public about alcohol in general and the risks to their health from different consumption patterns. So as a follow-up to the CIGA and the clinical treatment guideline for AUD, we also embarked on a project to develop resources specifically for the perinatal population. So I feel like all three of the talks really dovetail nicely together, speaking at kind of messaging for different populations and different communities. So what I'll focus on today is how can we amplify and promote those messages in the clinical setting. So if you go to the next slide, Lindsay, our main motivation and goal was to develop supports and practical tools and resources for clinicians who were treating patients who were trying to get pregnant, who were pregnant, or who are postpartum, who may be consuming alcohol, and to really support the clinicians in having those conversations, informing and educating their clients, but then also providing them with clinical evidence-based guidance on how to treat those clients so that they can reduce their harms or reduce their consumption. So really the purpose was to amplify the messages that were in the CIGA and the treatment guidelines, and to support prevention of alcohol-related harms, both to the pregnant person, but also to the fetus. In terms of methodology, how we developed the resources, it was primarily based on clinical research and taking messages that had already been published from those two guidance documents. But we also heard from perinatal clinicians across the country that there were lots of gaps in knowledge translation, and that what was really needed was some short practical resources that could fill some of those gaps where there was not enough evidence basis and where we really needed to rely on consensus and expertise. And we created a national committee that had approximately 20 people on it from different provinces across Canada, representing different fields of expertise. So not only gynecology and obstetricians, but also midwives, pharmacists, and family practitioners, and people with lived experience. And then we had two wonderful co-chairs who were perinatal substance use experts, which were Dr. Eric Catoni and Dr. Janine Hudson from Ontario. And our overarching goal in producing and developing these resources was also to ensure that the messaging that we were conveying was non-judgmental, non-stigmatizing, and supportive, just to really amplify what Nancy was saying earlier. So next slide, please. We were able to create a new website to house all of the resources and all the guidance and all of the tools that we created. So this slide is just to show you where you can go find all of the resources that I will be presenting to you today. So it's on the Help with Drinking website. It's probably really difficult to read the menus that I've put at the top here, but the very top menu on the website, you'll see a link for healthcare providers. So if you were to click on that, the sub-menu will pop up, and there is a link just for alcohol use in pregnancy. And that's where you will find all of the information and all of the tools that we've developed. So the first one that I will share with you here is really meant for clinicians as a kind of short, condensed treatment pathway. It's meant to be, it's actually like a printable thing that's even smaller than a single page. So it's meant to just be a really short, condensed, brief guide that guides the clinician in a step-by-step manner. So how do you start the conversation? What are the kinds of things you can say that are non-stigmatizing and non-judgmental, with really the message that, as Nancy and Adam have alluded to, that no drinking is safest if you are a pregnant person. But then what do you do with that information? What do you do if the client in front of you says that they have been drinking or that they are dependent on drinking? What do you do after that? So this treatment pathway provides screening tools that the clinician can use to determine kind of the level of risk or the level of severity. And then it also tells you step by step how to intervene and how to treat that client, depending on what the results of the screening test are. But to also give them some guidance and encouragement around telling the client and informing the client that there are ways to support them and that there are practical tips to encourage them to reduce their drinking if that's what the client is ready and motivated to do. So if you go to the next slide, this is kind of a companion piece to that treatment pathway, which is what Nancy alluded to as well. How to have that conversation can be a really challenging and difficult piece for clinicians. And so what they've told us is that they really could use some more resources and supports around how to have that conversation. So the brief intervention model is a commonly known model that that is based on motivational interviewing. And so 5A's is one of the common schematics that folks can use to guide them through that conversation, which is ask, advise, assess, assist, and arrange. So what we've created is a resource that follows the 5A's model, but is tailored to the situation if you are helping a client who is pregnant. So again, having a conversational tone, being supportive and encouraging, not judging the person in front of you for their drinking patterns, and then really just motivating them and encouraging them to reduce their harms, and then providing practical ways for them to do that and providing treatment if that's what's necessary. So this next resource that I'll show you was also designed specifically for clinicians. So what we heard from the clinicians we spoke to across Canada was that once they have a client in their care who is pregnant, they didn't really know what to do in terms of how to monitor the infant development or what interventions to take or what actions to take. So we developed this 5 tips from our clinical expert committee that we had developed. And it doesn't have a ton of detail on here, but it at least provides the clinician with some basic info about what to look for in the developing fetus, when to intervene, and then postpartum, what can you monitor for and what tools can you use? So if you look at number 4, it's recommending the Eat, Sleep, Console assessment tool, which is a supportive and supportive way to support the infant, but also prevents the overuse of medication when medication is not necessary and provides more holistic, well-rounded, and natural ways to support the infant if they are going through withdrawal from substances. And then step number 5 here also talks about doing a complete neurodevelopmental assessment in the infant at regular intervals to screen for things like FASD and to provide early detection and prevention of developmental disorders. So if you go to the next slide, just to show that we have other clinical resources that are available on the website that you can access if you're interested in more of the clinical side of things. So then what I'm more excited to show you actually are the client-facing information raising and awareness raising posters that we created. So these were also meant for being in the clinic. So these are the type of posters you could have in your waiting room. What we were really aiming to do here is We recognize that there's a lot of these awareness posters out there already, but in our research and kind of in our landscape scan, we found that a lot of the posters had slightly critical or harsher messages on them and were slightly fear-based. So a lot of the messages you'll see out there is, just say no, or, if you're pregnant, you should never have a drink. And while we agree with those messages, we also thought there was a space for creating a message that was more inclusive, more supportive, showed diversity, and was also encouraging people to get informed and to reduce their harms in a supportive way. So you'll see this poster here. If you go to the next slide, you'll see the other two posters in this series. Have you considered cutting down on how much you drink? So we were careful that we still wanted to relay the message that not drinking is safest if you're pregnant, and to convey the information that any amount of alcohol can harm the developing fetus, but to also provide that supportive and encouraging message. And to provide some practical tips. So let's say you are a client that is drinking and you now understand that that can cause harms. What are you going to do about it? So there's 7 tips here that are easy, practical, and short to help you support your readiness to reduce your consumption. Next slide. So this is just to show you on the website, if you want to access those resources, this is the page where you can find them. So you would navigate to the pregnancy patient handouts page. I also just wanted to highlight here that the posters I showed you were in English, but we've also created posters translated into several other languages. So depending on your community and the culture that you're in, you can access these posters in other languages. Next slide. This one I'm also particularly proud of. We saw that there was also a gap in posters that can raise awareness and educate not only the pregnant person, but all the people that are around that pregnant person who are part of their community and their circle of support. What can those people do to support reducing harms and prevention of FASD in their loved ones? So this poster was meant to be really eye-catching and inviting, visually pleasing, and gives 8, again, very easy practical tips for how a loved one can support that pregnant person in their life. And again, this poster is also available on the website and is also translated into 5 different languages. So we can move on to the next slide. And this last piece is really a tool that both the clinicians and the clients can use. So we developed this online interactive calculator. You would enter in your body weight and the number of drinks that you were either planning to have or are having. And once you push enter, it would spit out the number of hours that it would take for that alcohol to clear out of the breast or chest milk. So this is a really handy tool that the clinician can share with their client and that the client can use on their own if they are breastfeeding or chest feeding and they are still wanting to consume alcohol. And this is available on the website, but it's also very accessible on a mobile device or phone or whatnot. So that's been a very popular tool as well. So next slide, please. We also have some additional resources on the website that are available. These can be handouts that the clinician can print and hand to their clients. They're also available on the site as well for the client to view on their own. So information about how alcohol affects milk and fertility, and so just some basic tips on safe sleeping if you are consuming alcohol. So with that, I think that's my last slide. Yeah, so thank you so much for inviting me to share these resources with you. Like I said, the ultimate goal here is to support the clinicians who are educating and treating their clients in order to reduce the harms of alcohol, to reduce consumption if the client is ready to do so, and really with the ultimate goal of preventing harms to the developing fetus, including disorders like FASD. And so I'll also just say that if you want any of the printable versions of the resources that I've shared today, please shoot me a note or contact me at my email address here. Thanks so much.
Thank you so much, Nirupa. It's so wonderful to see how these moments in time have led to such phenomenal resources, not only about alcohol use generally, as Adam introduced, but then ending up with thinking about the perinatal population and clinicians. Thank you to our presenters today. This was a really rich and important discussion. And I really hope that for participants that you join us in future webinars. Our next webinar is on March 12th. It will be the third and final webinar in this series. To get more information on CanFASD and stay in the know with respect to all upcoming webinars, please check out our website at www.canfast.ca or follow us on social media to find our resources. And finally, we really hope to see you at the 2025 Canada FASD conference happening this October in Toronto. Details are on the website and in the chat. Thanks so much, everyone, and have a great day.